Do you experience severe pain during your periods? Do you experience severe pain while having intercourse? Are you unable to have a baby? You may be suffering from a condition called endometriosis, and it's called an enigmatic disease for a justified reason. It is a condition that is much dreaded by the women that suffer from it and also by the doctors that treat it, simply because it is a recurring condition. It's a progressive disease. It may have severe painful symptoms, and the endometriotic lesions may recur even after being adequately removed surgically. So, what is endometriosis and why is everyone talking about it? Endometriosis is basically a condition in which the lining of the uterus, which is the endometrium, is present outside of the uterus. It may be present in areas in the pelvis like over the peritoneum. It may be present as chocolate cysts, that is cysts filled with old blood that appear like molten chocolate. It may also be present between the vagina and the rectum. It may also involve the uterosacral ligaments, or it may also involve the bladder or the bowel. Even rare sites like lungs have been reported. When these lesions are present in the pelvis, it may lead to adhesions. Imagine two surfaces with blood in between them. What do you think will happen? They will get stuck to each other, and these are what are called adhesions. So, these ectopic endometriotic lesions bleed every month like the endometrium, which is the lining of the uterus, in response to the hormonal cyclical changes every month. So, the ovaries may be stuck to the back of the uterus. When both the ovaries are stuck, it is called as kissing ovaries. The bowel may be stuck to the back of the uterus. The fallopian tubes may be stuck to the ovaries, and it may also be stuck to the back of the uterus, causing distorted tubo-ovarian relationships. Endometriosis may also involve the wall of the uterus, and this is called as adenomyosis. So, what are the symptoms of endometriosis? They can cause severe pain during menstruation, even a few days prior to the beginning of menstruation. They can also cause severe pain while having intercourse, especially deep dyspareunia. They can also cause infertility. Usually, the pain is specific to the lesion of the disease. If it is present between the rectum and the vagina, there may be pain during passing of stool. So, I'm sure you're wondering why it causes infertility. For a pregnancy to occur normally, the ovary has to ovulate out an egg. The egg will meet the sperm in the tube, so the tubes need to be functioning normally, and the embryo is formed in the tube, which goes into the uterus and implants over the endometrium. In endometriosis, because of the chocolate cysts, the egg release, which is the ovulation, this may be hampered. Also, the quality of the eggs may be hampered because of the cysts. Next, if the fallopian tubes are stuck, they may not be able to pick up the egg efficiently. Also, if there's adenomyosis, the embryo may not be able to implant properly. I'm sure you must wonder what explains the presence of endometrium outside of the uterus, and there are many theories that attempt to explain it. One of the most plausible theories is the theory of retrograde menstruation. Here, they claim that the menstrual blood flows out of the uterus through the fallopian tubes, and it gets deposited in the peritoneum, in the pelvis, and grows cyclically every month. Others include transformation of peritoneal cells to endometriotic cells through immunological or hormonal changes, which is called as metaplasia. It is also posed to be initiated by genetic causes and presence of stem cells. Stem cells are cells that can regenerate into any kind of cells. For example, the presence of undifferentiated cells that turn into endometriotic deposits. Oxidative stress and inflammation have also been one of the few reasons. Improving our understanding on the pathogenesis will direct further work on improving the therapy for treating and curing endometriosis. The cyclical hormonal changes in the menstrual cycle affect these endometrial deposits in the pelvis and elsewhere. These grow and thicken under the influence of estrogen and progesterone, and they bleed when these hormones are withdrawn. This leads to inflammation and adhesions in the pelvis. Old endometriotic deposits may become fibrotic and cause dense adhesions in the pelvis. This may lead to pain. The severity, however, may not correlate with the pain. A woman with mild endometriosis may have severe pain, and a woman with severe endometriosis may not have that much severe pain. So, when should you visit the doctor? If you are experiencing pain, pelvic pain, pain during intercourse, pain during menstruation, or infertility, you must visit your gynaecologist. Also, you must visit if you have symptoms like pain during passing stools, which increases during menstruation. So, how is it diagnosed? The triad of dysmenorrhea, dyspareunia, and infertility is highly suggestive of endometriosis. Only if one suspects it can we diagnose it. A chocolate cyst may be picked up on a pelvic ultrasound and an MRI. Rectovaginal endometriosis in the form of a nodule may also be picked up on a very sensitive ultrasound and also MRI. But pelvic peritoneal lesions may not be picked up on an ultrasound or even an MRI. Hence, laparoscopy is the gold standard test to diagnose endometriosis. The procedure involves visualizing the pelvis to look for any endometriotic deposits. These deposits may appear as reddish-blue deposits in the pelvis, or dense nodules, or dense fibrotic adhesions. These can also be excised and sent for biopsy, which confirms the diagnosis. Excision of these tissues completely also effectively treats the disease. Adenomyosis can be detected on ultrasound and an MRI. And now for the most burning question: how is this condition treated? The treatment is usually individualized and is predominantly dictated by the symptoms. Younger women like adolescents, and for women that are not looking for fertility, medications can be tried. These drugs suppress menstruation and hence suppress the growth of these endometriotic deposits and aim to stall the disease progression. However, these cannot be given for long term as their side effects prevent them to do so. Sometimes medications may not work. In this case, one may need to do a surgical excision of these lesions. Laparoscopic excision of the endometriotic cysts, of the nodules, and of the peritoneal deposits are conservative surgical options for women that have not completed their childbearing. What's very important to know is that for a young woman with endometriotic cysts, and a surgery on her ovaries may damage and compromise her ovarian egg reserve. Hence, these women can be offered oocyte cryopreservation or egg freezing for later use. This is important to advise as endometriotic cysts can always recur, necessitating multiple surgeries. For women that need fertility, endometriosis is often a cause for unexplained infertility. This is when all parameters are normal, but the couple is still infertile. In this case, ovulation induction with or without an intrauterine insemination often works. If this does not, we may look at IVF. Or surgery can be performed. If cysts are present, the cysts can be excised, tubo-ovarian relations can be restored to normal, and adhesions in the pelvic organs can be released, and these patients can be given a trial for natural conception. Often, these patients conceive immediately post-surgery. Sometimes, when IVF needs to be performed, we retrieve the oocytes and then perform the surgery. After the surgery, we then put them on suppressive medications for 3 months and then perform the embryo transfer. Once these women conceive and become pregnant, the disease progression is halted, as in pregnancy there is no menstruation. Also, this continues in lactation. For women who have completed families and with intractable pain, the last option that remains is removal of the uterus and the ovaries if everything else fails. In short, every case needs to be evaluated individually, and the plan of management is decided based on the symptoms and the age of the woman. To conclude, if you have any of the symptoms that I've mentioned before, please do visit your gynecologist for an evaluation. An earlier diagnosis has a better prognosis and better management options. But thinking that you will never get pregnant with endometriosis is a myth. Let us debunk it for you. There is always hope at the end of the tunnel. If you found this video useful, do like, share and subscribe to us. If you have any queries, do leave them in the comments below. Also, follow us on social media on the handles mentioned in the description. Thank you and have a great day.